Gough Whitlam gave Australians Medibank so everyone could have the same high-quality healthcare. But after Medibank was dismantled by Malcolm Fraser's cutthroat coalition government, a trip to hospital meant bankruptcy for many. And although a universal healthcare system was reintroduced as Medicare by the Hawke government, successive coalition governments have eroded huge chunks of it, taking investment in Medicare to an all-time low. Let's talk about the rise in the cost of visits to your GP. The Abbott coalition government put the GP rebate into the deep freeze in 2014. It's only just beginning to thaw a little now. And because doctors' costs have increased enormously, the gap payment for non-bulk billing clinics has gone through the roof. That gap is the difference between the Medicare rebate for your visit to the GP and what it actually costs the GP to see you. That's why you might have paid $80 for your latest GP visit, but only got $37.40 back from Medicare. Go to a bulk billing clinic then, the government might say. But not everyone has access to bulk billing. For example, it's difficult to find a GP in regional areas, never mind a bulk billing one. And for bulk billing practices to survive on only being paid the Medicare rebate for a consult, they need high patient traffic to make ends meet. Which means people with chronic illnesses don't always benefit from what has been termed 6-minute medicine. 6 minutes is how long most bulk billing practices can allocate to a consult to make ends meet. In May 2021, doctors claimed that an estimated 1 million people in 1 year alone didn't go to their GP because they simply couldn't afford to. Consumers are being hit with $3 billion per year for non-hospital expenses. The increase in the number of people accessing and putting pressure on emergency departments underlines this, with 3 million avoidable visits made in just 1 year. Doctors are warning that we are moving toward a US model of healthcare, where the level of care you get will depend on the type of insurance you hold, or if you have insurance at all. As for hospital visits, APRA reported in February 2021 that out-of-pocket expenses for these have increased by 13% over the previous year. Now, the Morrison government is planning to shake up the medical benefits schedule yet again by implementing the recommendations of a 5-year review of the MBS. This will provide some benefits by removing superseded or outdated schedules, which will prevent surgeons from double-dipping on the same operation, for example. But the cost of many procedures will increase, like hip scopes and other orthopaedic surgery. Indications are that some surgeries might leave you up to $10,000 out of pocket. These changes are being brought in so quickly, there's not been enough time for doctors and health funds to work out what gap patients will have to pay. People having operations after the 1st of July 2021 could be caught out big time. There is no transparency around this. We simply don't know what the cost might be. But Australia's experience of the Morrison government's rollout of, well, anything, tells us that this is not likely to end well for ordinary Australians. This government would like you to believe that providing quality healthcare is unsustainable. This is not true. What they really mean is that they would like to throw money, your taxpayer money, at something else instead. Perhaps they'd rather be propping up Rupert Murdoch's empire, or replacing the public service whose job is to provide frank and fearless advice to governments with more expensive and more amenable external consultancies, who also happen to be major donors to the coalition. Perhaps paying excessive amounts of money for land to, yep, you guessed it, another coalition donor. A truly universal and fair healthcare system simply isn't a priority for them. It just doesn't fit into the coalition's IPA-driven philosophy. Who are the IPA? We have a video about that. It doesn't fit with Scott Morrison's Pentecostal belief that those who are poor are undeserving sinners. Thus, liberating people from reliance on the welfare state has become a God-given task. Neoliberals like Morrison see a universal healthcare system as part of the welfare state they're trying to liberate people from. Gough Whitlam's vision for universal healthcare has disintegrated. Medicare is now one very sick institution, and Morrison's habit of laying on of hands will do little to bring it back to life.